friends. Today I am going to talk about a very common and a very serious issue with all the healthcare professionals who are there in their private clinics or hospitals. Though it doesn't matter whether they are corporate or government hospitals, it is applicable to everyone. So there is something known as communication skills which are lacking these days between the healthcare professionals, the doctors and the patients. So it is very essential for a treating physician or a surgeon to explain whatever is the disease or whatever will be the treatment, whether it is a surgical treatment or a medical treatment. It has to be explained in a very proper and a clear language which patient understands, or one has to interview the patient along with the relatives. So he has to discuss, what the thing is going on. At least 5 minutes of time is very essential at the time when the patient is seen in the OPD or at the time when the admission is there along with the relatives, to discuss each and every aspect of the this disease process. And one has to discuss that what disease he is suffering from and what are the various available treatment options according to the literature, and what the hospital is capable of giving the treatment to the patient. And then at the same time, it should always be told that these are other treatments are better or less better, or whatever other modalities of treatment are there that may or may not be available in our center. You can take a parallel help or take a second opinion from someone else. So patient should have a freedom, it is the right of the patient to get education from the treating doctor, so that he can himself decide whatever is good or whatever is bad. So today, because of this lack of the communication skills, doctors are extremely busy. They are no doubt they are doing a very good work, but their schedule is so busy that they take these things for granted. So whenever you as a physician or a surgeon is so busy in treating, lot of patients are there, lot of burden is there, lot of overload is there, doesn't matter. You and your team member, your associates, your students, your colleagues can go have a word with the patient relatives and counsel them whatever is going on. It is a very essential way of treating the patients, particularly in a public sector hospitals like these days. The corporate centers are having no less responsibility. So it's very essential. People who are paying a lot of money for their treatment coming to the corporate sector, and the corporate hospital, it's the duty of them, since they have bought this treatment, they should be properly informed. And as far as the interventions and the surgeries are concerned, very important, very essential to take informed consent. You have to explain the relatives and the patient what procedure is there, just not to give some forms to the patient and the relatives to sign here and there and cover it medically. You have to explain the whole procedure while the patient is waiting for getting the surgery or a procedure. After the operation or the procedure or the intervention is over, it is the duty of the operating doctor to come outside, call the relatives. Doesn't matter, they can call on the phone also, talk that what operation is being done inside, whether the operation is done satisfactorily or not, whether whatever removal of the organ or specimen is there, it is removed or not. And one has to show it, whether it is a piece of appendix or whether it is a heart tumor or whether it is a prosthetic material which is to be taken out. It is to be shown to the relatives, and it should be properly informed, whether in a written or a video form, doesn't matter. But this is very essential. Because of this lack of communication between the doctors and the patients, we are unnecessarily encountering lot of conflicts between them. And you may be hearing on daily basis that there is a assault by the patient relatives to the doctor, or the patient relatives have come and broken the glasses and the windows of the hospital, emergency, this, that, and so many things are there going on. So what we are going to suffer these days because of that overburden we are having, and lot of other factors are there, is to develop a very good communication skills. You have to talk to the patient relative. This is a part of treatment. This is the most important part of the treatment apart from surgery and the medicines. You have to inform them that we have done an operation or whatever intervention procedure we have done. These are the two medicines which you want, after the discharge is over. So tomorrow morning you go home, or tonight you go home, you can take a breakfast, like light breakfast, take a sips of butter in the night. These are the two medicines. You are supposed to take one in the morning, one in the evening, and you have to come back to the hospital after 4 or 5 days. And these are our phone numbers, and if there is any problem, you can call. How much time it will take? It will take 2 minutes, 3 minutes, 4 minutes, 5 minutes, doesn't matter. If as an operating surgeon you may have other patients to operate upon, or you may have to go over the rounds and so many other things are going on, doesn't matter. You can tell your associate colleagues, whosoever are working with you, or the training guys who are working with you, to go to the patient relative and talk. See, why I am discussing all this thing recently, 2 days back, 3 days back, I also encountered the same problem. I have to take a treatment from some hospital, and same thing has happened to me. They are all good people, they have done best treatment, everything was fine. But this is purely because of the lack of communication. We had some conflict, and that resulted into a bad mood of not only us but the doctors also. So in order to avoid all these things, I propose that a very very good communication skills, whether you are working in a corporate or a government sector or a municipality hospital, doesn't matter. It's very important. We are dealing with a human life, and it should be dealt with dignity. So I wish that every human life should be dealt with a great human touch, and everything should be cared with compassion. Thank you very much. Have a nice day. Bye bye.